Welcome everybody. Hope everyone's having a good day. My name is Keon Alexander and today we will be discussing the training supervisors must go through to identify indications of drug and possible alcohol use while on the job. We'll start by discussing the signs and symptoms of possible drug or alcohol use through the 5 categories of drugs that the Department of Transportation tests for. These 5 are marijuana, cocaine, opioids, phencyclidine, amphetamines, and alcohol. There are different types of indicators of possible drug and alcohol use, ranging from physical indicators, behavioral indicators, speech indicators, and performance indicators. In Title 49 of the Code of Federal Regulations, Section 382.603, it states, each employer shall ensure that all persons designated to supervise drivers receive at least 60 minutes of training on alcohol misuse and receive at least an additional 60 minutes of training on controlled substances use. The training will be used by the supervisors to determine whether reasonable suspicion exists to require a driver to undergo testing under Section 382.307. The training shall include the physical, behavioral, speech, and performance indicators of probable alcohol misuse and use of controlled substances. Recurrent training for supervisors personnel is not required. Next, we have a citation from Title 49 of the Code of Federal Regulations in Section 199.241, stating each operator shall ensure that persons designated to determine whether reasonable suspicion exists to require a covered employee to undergo alcohol testing under Section 199.225, Part B, receive at least 60 minutes of training on the physical, behavioral, speech, and performance indicators of probable alcohol misuse. The last citation from the Code of Federal Regulations is Title 49, Section 199.105, Part D, which states, testing based on reasonable cause. Each operator shall drug test each employee when there is a reasonable cause to believe the employee is using a prohibited drug. The decision to test must be based on a reasonable and articulable belief that the employee is using a prohibited drug on the basis of specific contemporaneous physical, behavioral, or performance indicators of probable drug use. At least 2 of the employee's supervisors, one of whom is trained in detection of the possible symptoms of drug use, shall substantiate and concur in the decision to test an employee. The Federal Motor Carrier Safety Administration discusses under the educational and training in Chapter 4 that the purpose of this training is to enable supervisors to determine whether reasonable suspicion exists to require drivers to undergo testing described in Section 382.307. It must include at least 60 minutes on alcohol misuse and 60 minutes on controlled substances use, which concludes to 120 minutes total. The training may consist of formal classroom training, videos, written materials, online training, or other appropriate methods. However, interactive training is encouraged as experience has shown it is more effective than passive methods. The content of the training must include the physical, behavioral, speech, and performance indicators of probable alcohol and controlled substances misuse. We'll start off by identifying the indicators of signs of marijuana. So, in an employee, when looking for physical indicators, you can look for red eyes, poor muscle coordination, delayed reaction time. Some behavioral indicators may be reduced motivation and they have less interest in the work that they're doing. A speech indicator you can look for would be slow speech or the voice quality that they use when talking. And a performance indicator may be poor decision making or sharp memory. along with short attention spans while performing the job duties. Next, we'll discuss the signs of cocaine use. To begin with the physical indicators, we have dilated pupils. This person may be hypersensitive to light and sound and may experience nosebleeds. Some speech indicators may be rambling and rapid talking, and behavioral indicators such as risky or unsafe behavior. The performance indicators of this employee would be poor judgment and excessive enthusiasm. More enthusiasm than what they normally would have, of course. And some signs of opioid use would be the physical indicators such as needle marks along the body, small pupils, slurred speech whenever we going along the lines of speech indicators. Some behavioral indicators can be they can't stay awake. And then when looking for performance indicators in the employee, they may be making impulsive decision making. Next we have PCP, phencyclidine. The physical indicators would be weakness and dizziness. Speech indicators would be slurred speech, very talkative. Behavioral indicators such as aggressive mood, quick mood changes, behavior along those lines. And performance indicators in the employee would be slow reflexes and distorted judgment. Next, we have the signs of amphetamines use. These physical indicators would be dilated pupils, rapid breathing, non-stop sweating. Some speech indicators may be that they're more talkative than usual, but when they're talking it's real unclear. Some behavioral indicators may be they're hyperactive, restless, aggressive moods, also anxious. And then the performance indicators to look for in this employee would be them being uncoordinated or having short attention, trouble doing regular tasks that they normally do without a problem. Lastly, we have the signs of alcohol use, beginning with the physical indicators such as them putting off a strong odor or having heavy eyes or slurred speech and stuttering, looking along the lines of speech indicators. And then under behavioral indicators we have slow reactions and uncoordination. And then under performance indicators we have that employee not being able to perform their normal job task efficiently as they normally would. And then here we have our references, just citing the Code of Federal Regulations, those training for supervisors, the drug tests that they are required to look for, the Federal Motor Carrier Safety Association, and then a few articles from some journals just discussing signs to look for possible drug and alcohol use. I hope this can be of use to some of y'all when looking for possible drug and alcohol use, and that everyone has a good day. Thank you.